Thanks a lot, Nick, for joining us today. Thanks for all the work that you are doing at Tinnitus UK. Tinnitus UK is a non-for-profit organization which is doing a lot of very valuable work. We have been working with Tinnitus UK for already quite some years, and it's always a pleasure to see the work that you are doing there. So thanks for joining us today, and looking forward to hear your talk.
Thank you, and thank you for asking me to come along this evening. As Fabrice has said, and I thank him very much for his kind words. We're very much the voice of the patient. We are a patient organisation, people living with tinnitus, and we want to make sure there's nobody suffering from tinnitus. So we want people to get to a place where they can live with it, but not be distressed by it, whilst we're also looking for a cure, because that's our ultimate aim. And in the meantime, we want to make sure everybody has access to the best possible information, and that research and awareness of tinnitus is high on people's priorities. So I work primarily as a communications manager. It's a bit of a catch-all job because I'm responsible for our health information, the campaigning and awareness work that we do, research dissemination, and I also do a bit of press and media when necessary. So I've got some contact details here. Yep, I'm sharing tinnitus awareness with an alpaca. So please do get in touch if there's anything you want to know. Now, the topic, the title for this talk is Autonomous Tinnitus Management, and it's based very much on a book chapter of the same name that our president, Don McFerrin, and I wrote, which was published in the new edition of the textbook of tinnitus. So it's based on the research that we did for that. Now, I know some of you are perhaps new to tinnitus, so I'll start with a definition of tinnitus. And actually, it might surprise you to know that there isn't one standard agreed definition for tinnitus, although there seems to be one standard picture in image libraries. When you search for tinnitus, it's always somebody with their hands over their ears. But the definition that was come up a couple of years ago by a group of clinicians and researchers has defined two things. One is tinnitus, which is the perception of sounds with no identifiable corresponding external source. And the other, which is a new development, is a definition for tinnitus disorder, and that is tinnitus with associated suffering. And that can be emotional distress, it can be problems with concentration, it can be problems with increased levels of stress, and that can lead to changes in behavior, and it can act, people with tinnitus disorder may be functionally disabled, and these are actually quite good working definitions. They're not without some issues. People living with tinnitus weren't involved with the development, but they're a pretty good kind of snapshot of the state of our understanding of the conditions at the moment. I mean, I would say that I have tinnitus from time to time, but I don't have tinnitus disorder because I don't find it troublesome. But most of the people we come into contact with at Tinnitus UK, and probably most of you on the webinar, are here because you do find your tinnitus bothersome. So now we've defined tinnitus, what's autonomous tinnitus management? Well, when Don and I were asked to write the book chapter, it was initially suggested that we call it self-help for tinnitus. And so we went back to definitions again. And there's no clear definition of self-help. And it's used in different contexts and it has different connotations. So we decided that the terminology didn't really work for us. So we altered the title to Autonomous Tinnitus Management. Don can get away with doing things like this because he's so well known in the field. And we came up with our own definition, which was the measures taken by an individual to address their own medical symptoms or conditions, which in this case is tinnitus, without using the direct input of a practitioner of conventional or complementary and alternative medicine. And that meant that we could exclude some treatments from what we were looking at, such as internet-based CBT, because there's usually some contact with a healthcare professional. But we included some interventions such as yoga and Qigong, because although they're delivered by trained professionals, well, we hope they are, those people aren't medics. And actually, if it wasn't complicated enough, there's really a lack of good quality evidence on this topic. So what I'm going to talk about is from quite a low evidence base. And people with tinnitus who are using these treatments to manage their own tinnitus, you're not writing a rigorous paper for a peer-reviewed journal. You're doing it. So it's a bit of a paradox, but most evidence that there is on measures that people use to improve their tinnitus without input from a clinician actually comes from clinicians. So the first step that most people take when you're confronted with a new medical condition or symptom is to try and find information about it. And humanity has been recording information about tinnitus as far back as written records go. We've got things on wax tablets, we've got things on papyrus scrolls, we've got lots of information going back a very long way. And now accessibility has dramatically improved for information on tinnitus, even from my lifetime when I developed tinnitus in my 20s. There was no Google, there was no internet. And you can now search online for tinnitus information. And if you do, you get tens of millions of results. And online booksellers such as Amazon, you get hundreds of tinnitus related books. Now, there's a widespread impression amongst healthcare professionals that information is actually a key component of tinnitus management. And several of the most widely known guidelines recommend information should be given and given early. Now, the recommendations do seem to be based on opinion because the supportive evidence for this is quite scant. And okay, as a writer of tinnitus information and evidence-based tinnitus information, I'm quite happy that they're telling people you need information, but it is just an opinion, certainly at least as far as information with people with tinnitus is concerned, because it's not really been looked at. Now, in the UK, we have a body called NICE, which is National Institute for Clinical Excellence, and they produced tinnitus guidelines in 2020. And they did an evidence review on patient information, and their evidence review suggested that these 4 topics were what people were looking for when they were diagnosed with tinnitus or they started experiencing tinnitus. And from our experience at Tinnitus UK, these sound pretty reasonable. Apart from looking for information about tinnitus prevention, no one's looking for that, which is a bit of an issue. It needs more research as to why, and it's a bit of an issue for us as an organisation because one of our pillars is prevention. Makes our job harder, but also shows how much that work's needed. So this was what NICE thought, 4 topics. These are what the people who wrote the European guidelines for tinnitus suggest that people with tinnitus should be provided with. And that's a pretty long list. I kind of took one look and went, wow. And again, there was no evidence for this choice actually given. But when I looked at the list a bit more closely, it looked pretty familiar to me. So I did some digging around Google Analytics for the Tinnitus UK website. And our most popular pages are broadly congruent with that list, with some notable exceptions. Popular page with us is musical tinnitus. Another one is about food and drugs. But if information is an essential element of your tinnitus management. Actually, there's a poor knowledge of tinnitus in the general public, according to NICE, and awareness of specialist organisations like ourselves is actually lower than we would like it to be. So there's been virtually no research looking at information-seeking behaviours in people with tinnitus. So I'm going to talk a bit more generally about health information. And I've already kind of intimated that the way people get health information has changed dramatically over the last 20 to 30 years. However, in a recent German study, most people prefer to get their health information from a doctor, but 4 out of 10 preferred the internet and smartphones. Books, leaflets, and magazines were next, and then trailing under 2% were self-help groups. Now, if you're getting your information, and we know that it is helpful, then online resources, they're generally convenient to access. You're probably all sat here in some degree of comfort from your home, but you might be commuting, you might be at work doing multitasking. So it's convenient, it's widely available. You're anonymous. I can't see who anybody is. But it can be frustrating. Search engine results aren't impartial, and credibility and trustworthiness are known to be concerns. And the use of AI in Google searches, which has just launched, is a wee bit worrying. Social media, another way of getting information, used by over half the world population, but much of the research is about how people use it to give information, not how people use it to get health information, or if you get any benefit from doing that. So peer support can help people address issues together. You go into a group, but the open nature of social media means there's no quality check on information. And sometimes you can get health-related conspiracy theories and other inaccurate information. Now, it's long been understood that you only retain a small proportion of what's discussed in a consultation, however focused we think we are. And your recall is improved if you're given leaflets to back up what's discussed. And leaflets, although some of the caveats about online information may apply, they're generally less of a concern because of the high barriers to entry, i.e. the cost of producing a leaflet, and the narrower distribution. And tinnitus leaflets, there's actually been some studies on these, and these demonstrated that if a service gave leaflets to tinnitus patients, there was actually a benefit to the service in that fewer people came back, there were less waiting lists, they were seeing less patients, but it failed to answer the question as to whether the leaflets actually helped the patient. Books, well, if you head to an online bookseller, I've already said, you'll see several hundred books with tinnitus in the title. Now, these can range from the scholarly and expensive tomes, like the one we've contributed to more reasonable and accessible self-help books, e-publications talking about particular supplement, or people sharing their tinnitus experiences. There's a whole range. And an Australian study looked at the efficacy of what they called bibliotherapy in helping people experiencing tinnitus-related distress, and found that compared to a waiting list control, those who'd received a self-help book had showed a significant reduction in tinnitus-related distress, and that was maintained at 4 months and at 12 months. Good news. Downside, there was considerable dropout from the trial. 35% in the active group failed to complete the study, which may mean they didn't read the book or respond to questionnaires. And finally, well, not finally, next to last one, mass media. You'd think that might be helpful in raising awareness and giving good information, but sometimes coverage can be a bit misrepresentative, pessimistic, sensationalized. You see, the problem is there's no news value in celebrity has tinnitus, isn't bothered by it. There needs to be a hook and an angle. And sometimes some media outlets, I won't name any names, but I've had this happen with when I've been working with particular ones. They cut and paste online information they found in the middle of a decent evidence-based story, and sometimes they just don't even bother to talk to organisations or clinicians, or they'll ignore a contribution if it doesn't fit the story angle. So you sometimes have to watch what you get from media. Tinnitus apps are on here, but I'm not going to mention much here because we have way more expert people in the room, and there are lots available. From our experience, well, the research experience shows that people don't tend to look for them for information, but again, that might be changing. I know Fabrice, when we were talking earlier, is telling me about all the information that's put on the MindEar app. But in the early days of the apps, people have been mainly looking for them to help with sleep issues or to provide sound therapy and relaxation, and they're things I'll talk about later. Need to talk about briefly health literacy, because that's someone's ability to understand and use information to make decisions about their health. And low health literacy levels lead to low health status. It's not about your reading ability entirely. It's also about the accessibility of healthcare systems, the communication skills of the people who are talking to you, your healthcare professionals, and the level of complexity of the information. So actually, we've got to be quite careful to make sure that people understand any information, because certainly in England, the average reading age of a working adult is about between 9 and 11. So moving on, peer support. That involves people sharing their lived experiences to provide knowledge, social interaction, emotional support, practical help, and hopefully both givers and takers will find that beneficial. It's different from other kinds of support because you're getting that support from people with relevant experience, and that can be done in many different ways. They're listed on the slide here, and peer support's been used by people experiencing a wide range of physical and mental health problems. And a recent survey which compiled information from more than 1,000 studies concluded that there's evidence that peer support can help people feel more knowledgeable, more confident and happy, and less isolated and alone. And there's a long history of tinnitus support groups. Tinnitus UK started as the British Tinnitus Association, which was founded in 1979 by people living with tinnitus who formed support groups in their local area, and they came together to form a national organisation. And current guidelines for tinnitus recommend that people should be told about their local and national support groups. These can include now online support groups, and they're low cost and easy to access for people. And the benefits of participation seem to be similar to attending face-to-face support groups. So we know these things work. They can be hosted by various different organisations, charities, patient groups, part of a wider platform. And at their best, the online ones have many of the advantages of a support group, but without moderation policies, the quality and reliability of the information shared can be questionable. And sometimes they fall into a very negative kind of space. Befriending is a relatively new thing. Some organisations, certainly for tinnitus, it's been offered by other organisations for other conditions, and there's no research has been taken into tinnitus befriending as to whether it's effective. But a review of befriending in different patient groups has shown it can actually positively affect depressive symptoms and emotional distress. I'd be remiss in talking about support groups if I didn't plug the Tinnitus UK one. We have 80 in-person ones in the UK, and we also have some that are purely online. if you scan the blue QR code, you'll get taken to our list of support groups. If you scan the red one, you'll be taken to our forum. Our online support groups include specialist ones for musicians and for people with sound intolerance, as well as tinnitus. So that's peer support. And I think you're probably taking some form of peer support being here today. Sound therapies is the next one I want to talk about. And again, records of using sound to manage tinnitus go back almost as far as records of tinnitus. And studies have shown that sound enrichment is one of the most common strategies used by people living with tinnitus. And it generally comes in two forms: environmental sound enrichment and wearable sound therapy. And sound enrichment uses a sound source to add sound to the general environment of somebody living with tinnitus. And it sounds a bit counterintuitive to add more sound when you're already experiencing a sound, but it does seem to work. Now, sometimes sound enrichment comes from sound amplification, so the use of hearing aids, or for those with a profound loss of cochlear implant. I'm not going to talk about those because they're not autonomous, because you get those through a hearing professional. I know in the US they're talking about over-the-counter hearing aids, but that's a whole different board game. User-led sound therapies can be done in loads of different ways. Electronic sound generators, often they produce nature sounds, but they can be any kind of sound. So waves on the beach or white noise. You can get sound enrichment by opening a window or running a fan. The wearable ones, so maskers, white noise generators, you can get those purchasing them off the shelf, but sometimes they come via health professionals as part of a structured management program. And sound therapies can be delivered by apps, either sound enrichment or by using headphones, sort of almost like a wearable. And studies seem to suggest this is actually the most used function in tinnitus apps, but maybe Fabrice can comment on that later. There have been some studies looking at sound therapies, although that's been sound therapies provided by health professionals. And there have been 2 Cochrane reviews, which are sort of the gold standard of evidence bases. And they concluded that actually the available evidence in terms of studies was low quality, and there wasn't enough to support or refute the use of sound therapy for people with tinnitus. But it is something that's safe. There's been no reports of adverse effects. And we know anecdotally that people do find it beneficial to use sound, particularly in their early days. And one of the uses of sound is actually because it can be quite relaxing, as well as we're talking about sort of how it's working on the auditory system. And relaxation techniques, again, they're widely used and recommended, but there's actually surprisingly little research regarding stress and relaxation in people living with tinnitus. There has been some more recently, but it's quite a new development. Now, compared to equivalent conditions, so chronic pain or fatigue or fibromyalgia, there's 16 times more relevant publications for stress in chronic pain, 6 times more for chronic fatigue than there is for tinnitus. And I'm getting stressed because my slides keep moving. Anyway, a recent study by Eldra Burkis and her team showed that applied relaxation was effective, but other studies have been a bit more mixed. Relaxation apps, again, widely available. None of them have actually been investigated with respect to their effectiveness in people with tinnitus. And there's no studies actually looking at relaxation as an autonomous tinnitus management intervention. So maybe that's something for any researchers amongst you to kind of take on board. Diet. Now, the idea that tinnitus can be affected by what you eat or drink isn't new. The Roman records recommend, some physicians in Roman times recommended that people with tinnitus should give up wine. So the no drinking message is not new. And especially online, there are many reports of food and drink causing tinnitus or making it worse, and quite an equally large number of suggestions about changing diet to minimize or silence tinnitus. Again, relatively few studies have looked at this, and some of these offer conflicting reports. So a study using the UK Biobank data, which is an incredibly large scale data set, suggested that tinnitus was more common in people who have an increased intake of fruit and veg, but a US study said no, higher fruit intake, that's helpful. And a study of teenagers as well, higher fruit intake's helpful. More research is needed, as ever. That's a repetitive cry, I think, from here, because association doesn't mean causality. And so there's associations seem to only be associated with a minor change in risk. So it does seem likely that actually diet isn't a major contributor, and that if you make changes, well, you actually might be more disappointed, and the stress of changing your diet and avoiding caffeine, gluten, dairy actually might make things a bit worse because you're stressed and focusing on your tinnitus. Going back to alcohol, the recent systematic review looked at the possible association between alcohol consumption and tinnitus, and the authors did a pooled analysis and decided that there was no relationship between alcohol consumption and the risk of tinnitus. So that's probably a heap of hacked off teetotal Romans now. So if you want to have a glass of wine, I'm not going to stop you. Now, the Romans probably didn't have caffeine, and I'm kind of thinking, well, that might be a good thing because they'd have taken over the world if they had. But avoiding caffeine-containing drinks is one of the most common pieces of advice given to people with tinnitus. And actually, 2 large reviews have concluded that caffeine's unlikely to be a risk factor for tinnitus, and there's no supporting evidence to restrict it. And a new triple-blind placebo-controlled trial has concluded that caffeine has no significant effect on psychoacoustic measures, electroacoustic measures, or tinnitus-related degree of discomfort. So I think we can all go and get a triple espresso. Dietary supplements. Well, that's a huge global business. About £205 billion in 2021. And in a study which looked at just under 2,000 people with tinnitus from 53 countries, almost a quarter of people said they use dietary supplements such as vitamins, minerals, and herbal medicine. And the most commonly reported ones were these 6. But 8 out of 10 respondents said that taking supplements either had no effect on their tinnitus or that their tinnitus worsened while taking the supplement. And I've summarised the research findings here based on the traffic light system that we use on our website when we're talking about treatment. We look at them under 2 headings, safety and efficacy. For safety, red means there's potential for harm, amber, there's no evidence either way, or side effects would be limited, and green means it's safe. And then for efficacy, red means there's evidence of no effectiveness, amber means there's no evidence either way, often because of limited research, and green means that there's evidence it's effective. So as you can see, there's some supplements it's likely to be safe to take and some not, but there's no evidence that any of these supplements actually work. And on the Tinnitus UK website, we have over 880 treatments for this listed. There's a couple of hundred still to consider. Not a single one has a green light for efficacy. And that includes some things like hearing aids, simply because the research base isn't there. Now, 3 out of 4 of the most commonly consulted practice guidelines say really clearly that dietary supplements shouldn't be recommended for tinnitus. And to be honest, my opinion is the only effect that they're likely to have is on the contents of your wallet, especially some of the brand name ones which sell for $69.99. You know the ones, you've looked at them. Cannabinoids, I've put these in with dietary supplements because they're often sold that way in little gummy format or as oils. Cannabinoids are extracts from plants, cannabis plants. There's actually over 100 cannabinoids, but the two you need to know are CBD and THC. I'm not even going to pronounce what they stand for. But CBD is the one that doesn't give you a high. HTC, yeah, THC is. In the UK, CBD is legally allowed to be sold. THC is not. I don't know what the exactly what the situation is in different countries. They are very much in vogue. If you look at the adverts online, social media, spam, our forum gets spammed regularly with it. I've actually had spam to my Tinnitus UK email address offering machinery to make my own CBD gummies. Hey, not going to happen. There's not been that many studies on the effects of cannabinoids on tinnitus, but the current evidence from animal studies suggests that actually they could lead to increased activity in the auditory areas of the brain and hence actually increased tinnitus. And the side effects of CBD products can include nausea, fatigue, irritability, and they can affect your liver too. Now, when I've looked into CBD gummies, and I see a lot of these and look at the different brands, there's confusing information out there about what the products contain. Different suppliers list different ingredients for the same product, so it's actually really difficult to know what's in there. And the supplements market's unregulated, so products will vary widely in quality and ingredients, and some might not contain any CBD at all, and some might contain legal levels of THC. And if that wasn't enough, some people who've bought CBD gummies, when I've asked people about their experiences, have actually told us that they've been open to fraud. People have had larger than expected payments taken from their credit card, and we've seen for ourselves that some buyers' full details were easily viewed on one of the product selling websites. So you could be opening yourself up to fraud and identity theft, as well as not doing anything for your tinnitus. Okay, from one oil to some more. Aromatherapy. It's using fragrant essential oils for well-being, and again, treatment that's really old. Avicenna 1,000 years ago mentioned lily and spotted orchid oils as remedies for tinnitus, and they're still sold for those today. Sometimes essential oils can fall under food regulations and sometimes drug regulations, depending on how they're used. And the same sort of caveats apply here as they did to dietary supplements in terms of control of production. And although product safety laws can apply, many plants contain materials that are toxic, irritating, or can cause allergic reactions when applied to the skin. So you've got to be careful with them. And there's actually no evidence to support or refute their use as a treatment for tinnitus, but there is limited evidence to support the use of aromatherapy to improve sleep quality and to reduce stress, anxiety, and depression. So it might be something to consider, but it's not something that we'd recommend for tinnitus. Exercise is often a topic discussed on online support groups. There's not a lot of evidence regarding this topic in terms of self-help or, just going away and doing it yourself. The only evidence comes from medically supervised studies. And there's been some quite new evidence come out at TRI last year. They were discussing physical exertion, and physical activity does seem to be associated with fewer reports of tinnitus. There's a couple of types of Chinese martial art that incorporate exercise in addition to other components, so Qigong and Tai Chi. And a randomized control trial of Qigong showed that people who were taking the exercise showed improvement, and the effects were particularly marked with people with somatosensory tinnitus. Tai Chi hasn't been trialled in the same way. Yoga has, and there's been a systematic review looking at 4 of the studies, and 3 out of 4 of those studies said yoga is beneficial for people with tinnitus. And it doesn't have to be the really exerting, bendy type of yoga. It can be sort of chair yoga. You can take it quite easy, which is good news. Finally, ear care. So earwax is frequently mentioned as a potential cause of tinnitus, and wax removal is quite commonly discussed on tinnitus forums, and it's one of the most popular pages on the Tinnitus UK website. If you visit a popular online retailer, you can get a huge array of wax removal products to buy, from drops, devices for irrigation, instruments to put in the ear, and even small endoscopes linked to your own mobile phone. And of course, there's cotton buds and even ear candles, and there's no evidence base for any of these products. There's been a Cochrane review which looked at eardrops, and there's weak evidence to support the use of eardrops compared to no treatment, but there's no high quality evidence to suggest which eardrop is most effective, or even whether they're better than plain water or normal saline. Cotton buds, yeah, lots of people use those to clean their ear, but at best they're ineffective, and at worst they're potentially harmful, and there's no good evidence regarding cotton bud usage and tinnitus. It's a bit of a cliche when audiologists say don't put anything smaller than your elbow in your ear, but they mean it. Cotton buds can do damage, and so can ear candling. The consensus is ear candles are ineffective in wax removal. I would probably say something stronger. And actually, they've resulted in significant harm to some patients. People have had hot wax dropped onto their eardrum. They've had their hair set on fire. They've had lots of nasty things. Another thing that's dangerous sometimes is noise exposure, and it's a significant risk factor. And a large cross-sectional study said that nearly 3/4 of people said they'd been exposed to loud noise recreationally in the last year, but only 2% said they wore hearing protection. So that's something that needs to change, and something that we can campaign about, and we do campaign about. So in conclusion, people often tell me, or I've been told there's nothing can be done about tinnitus. And I get really quite cross about the people who say that, especially if they're medical professionals, because they should know better. I mean, I think it's fair to say that there are certainly many things that can at least be tried. And the other thing I get cross about is when people tell me, I've tried everything and nothing worked. And what they mean is that they listen once to a sound of the CCD, or they went to a support group and they didn't like it because they weren't talking about a cure or what could cure tinnitus. I think you've got to, when you're giving any of these things a try, the ones that work, you've got to give them time. And I think part of the issue is there isn't really a guidebook on how to do this. And there's a bit of a risk if you're very distressed by your tinnitus, you'll undertake a bit of an eternal quest for the one thing that will work. But actually, lots of things can work. You've got to give it time, and you might need to use a combination of things. And you have to realise it can be a bit like physiotherapy after injury. It can be repetitive, it can be tedious, and the improvement can be minuscule day to day, but it will happen. As I think Fabrice said, there is hope. things do happen. I've said lots of negative things, and I don't want that to be the message that you take away. I want that to be the message, well, I know what not to do, but these things I can do. And I think that's where this lack of guidance is the big worry, because there are some things that can be helpful. The evidence on some others is less clear, but we know they work for some people and not for others. But there is evidence for some that there's no effect, and that some of them actually have potential for harm. And it's important for everyone, health professionals, support organisations, people that you speak to who are also experiencing tinnitus, that we encourage and facilitate the interventions that we know that work, that use reliable information, that incorporate techniques such as sound therapy and relaxation exercises, and that people know about them and use them, and that people are actually discouraged from the unsafe things such as dietary supplements and ear candling. And, you know, we do need more rigorous large-scale studies to make a stronger evidence base so that people can make better decisions. You're not left looking around the internet to find what's going on. There would be something, you know, so people do know about the opportunities and the options they have to when they're self-managing their tinnitus. For more information, I've talked that there's some good information, there's some bad information. These people are all really good. Tinnitus UK, our colleagues, the RNID, American Tinnitus Association, British Society of Audiology. You're here because you know and trust MindEar, so I would add those to the others. So if you're ever in doubt about any of the information you read, contact us at Tinnitus UK. We're probably aware of what's out there, and we'll tell you our opinion. And that's the end of the formal bit. I'm sorry if I've gone on a bit. Thank you for your attention. I'm happy to take questions. Please bear in mind I'm not a trained medical professional, so I can't answer questions on your specific situation, but I'll do my best to help. Thank you very much.
Thanks so much, Nic. That was brilliant. And like this topic is so important to for people who have been in this webinar. We often basically talked to different treatment options that we know have shown to be helpful, like cognitive behavioral therapy, relaxation, mindfulness, sound therapy, education. And it's also very important to understand what are the treatment options which have less evidence. Tinnitus is complex. That's also like another thing which is very really important to understand if you're in this audience, and meaning that we still have a lot of research. There's still a lot of research which need to be done to understand the impact for each subgroup. You might experience the way you experience your tinnitus might be very different to your neighbor. And even though there's one word to define tinnitus, there's tens of subtype, and that's probably the reason why it's good to inform yourself, to talk. Tinnitus UK is doing an amazing work in trying to provide the information that can help you to identify which treatment can work, but also to talk to professionals who are experts in the field, like who are interested. That's probably also one of the things that is quite challenging, is to find a tinnitus expert where you live and where you are. And it's also why we initially created MindEar, in order to give a platform, an online platform that can give access to information wherever you are. And that's the beauty of the internet. You might be sitting in the US, you might be sitting in the UK or in Australia or wherever you are. You are still able to be here today and then talk to us. So thanks so much, Nic, for this overview on the different treatment options. We have quite a few questions, and then I would like, before going into the question section, I would also like to give you some information about, here we go. I'd like to give you some information about the MindEar programs that we developed at MindEar. There we go. You should be able to now see the screen. And so at MindEar, for most of you might already know that we developed an app, which is here to really help you to gain access to some of these treatment options that we talked about, which are mindfulness, relaxation, in order to allow your body to go out of the fight or flight response, which can be kicking in, which can be present, especially when we are stressed about what can happen, or there's definitely some evidence behind the efficacy of mindfulness to help with tinnitus. We also have inside the MindEar app access to a library of sounds, which are often used when going to bed to sleep, but also can be used during the day with a device, and I'm going to talk a little bit about that. And one of the main components of the MindEar app is the cognitive behavioral therapy section, which is the treatment option which has the most evidence today for efficacy. What is cognitive behavioral therapy able to do is to help you to understand or try to see the link between how you think and how you feel. There's often we think that some of our thoughts are facts, where it helps us to gain some perspective and help to reframe our thought in more neutral or more positive way, and it can definitely help us in how we progress with our tinnitus. All these treatment options it takes time, it takes resilience to see improvement. And we did a clinical study, and this is like some results that were published this year in Auckland, in New Zealand, where we looked at the efficacy of getting access to the MindEar app. We saw in this study, we had two groups. One group was getting the MindEar app in isolation, where the second group was getting access to psychological support every second week for 8 weeks. What we saw that after 16 weeks, we saw a significant decrease in tinnitus distress for 64% of the people who attended, who started this trial in the group who had the MindEar app plus the online support. And we had 42% of people who had a significant decrease in their TFI, the tinnitus functional index, for the group who was using only the MindEar app. After a slightly longer period of time, after 16 weeks, we saw that for both groups, we had 64% of participants who had a significant decrease in their TFI, which is a representation of how bothersome is tinnitus. Which means that, and we know that it can take months, but we know that already after 16 weeks, we see like a significant decrease or significant improvement. We are conducting more research at the moment in collaboration, but some of the research is done in the UK in collaboration with UCL, and we want to also see the effect at a longer term, so meaning at 1 year and more. But the message here is like getting access to some of this technique can be helpful, and we can see already benefits within like a relatively short period of time, and we need to sort of found in this different treatment option, we need to be able to find what works also for you. At MindEar, we are putting together like a package where we give access to a combination of the app, some group support. We have like 6 tinnitus group coaching sessions. We give access to some open earbuds, and the open earbuds have this advantage to give you access to sound therapy during the day. These earbuds are both devices, which are completely open, meaning that you have the possibility to get access to the sound therapy without being blocked and without having to stop any signal, external signal, to enter your ear. And we have included also a sleep band, which can be used especially at night to get access to some good sleep. And for the attendees of this webinar, we have a special price tonight, and I will be writing a link, sending a link to you after this webinar, where this package is accessible for $649. On top of that, we are organizing a lot of masterclass at MindEar about specific topic. It can be hyperacusis, can be somatic tinnitus or TMG, it can be, and then give you access to all the masterclass on top of the group session. So what we try to do is really giving you access to a comprehensive package which you can get access online and from your home. And that's really our mission at MindEar, to sort of like give you the best care possible, and to continue also our research in order to validate the treatment options that we offer. If you have any question, I would recommend you to book an appointment with a person in our team. You can use or scan the QR code, which is here, and I will let the QR code on the screen during the Q&A section. We offer you a 15-minute free call with us in order to guide you and in order to offer you as a treatment option which is suited for your need. And as I said when I started talking, tinnitus is a complex condition, and we need to be able to understand your history, and we need to understand also your needs and where your difficulties are in order to offer you a treatment option which can work for you. But now I would like to go into the Q&A part. We have quite a few questions, and I think I will have to go through them and try to answer as many as we can.
Okay. I've got the questions up. There's some that Fabrice I will leave to answer. The first one's not actually a question, it's a comment. Someone's pleased that a pint and a cup of coffee are still on the table, and I have to say I am too, because you're taking my latte macchiato. You'll have to prise it out of my cold dead hands, even if I'm having a tinnitus spike. So the first question: TENS machines for tinnitus relief. Again, there's not been any evidence for this, but we do know that some people who have tension in their jaw, or they have a neck or upper back injury, can trigger tinnitus, or people have a type of somatic tinnitus, which means that their tinnitus is affected by the muscles in the jaw or the neck. It would be something I would say talk to your doctor or a physio about. Don't just randomly put these devices and patches on your neck or your face or anywhere, but it's something that you might want to consider if that might be something that's triggering your tinnitus.
Maybe I can ask something on this one. We are running like a masterclass which is going about somatic tinnitus with Dr. Anne-Marie van der Waal, which is brilliant. I'm going to release the recording in the coming days. And for anybody who has access to the premium version of MindEar, then you can go and look at this masterclass, which is brilliant and which is going to give you exercise in order to release tension in your jaw and potentially in your neck. So I would really recommend to have a look.
There you go. You're covering everything, aren't you? Hazel has asked, what are the best earplugs to use in noisy situations? And I would say the ones that you remember to wear and the ones that you take with you, because they don't work if they're stuck in your bedside drawer. I always carry a small pair in my bag that fit into a pocket if I'm going into a gig. I actually use, because they're the most comfortable and I get the best sound fidelity for the price, little silicon flanged ones from a company called ACS. They're called musicians' earplugs. They have attenuation across all frequencies, so the music is as clear as it would be, but the volume is lower. And because you can get different shaped tips and size tips, they're comfortable, they're flexible. In the UK, they're about £15, so they're quite cheap. If you're going to a festival, you don't need to worry too much if you lose them. You're not going to be out a huge amount of money. But the ones that are the best are the ones that you wear. Would be
I love
to
that.
one.
And it's like, if we can make sure that like it's the music festival season is starting, so anybody in the audience who is going to go to a music festival, then try to remember them. And like the second thing is like on that aspect, in case you don't have earplugs, the distance to the source is essential. So try to remember to not place you too close to the speakers in case you don't have them.
Yeah, don't be under the speaker, and take a break. If you're at one of the big festivals, go to the chill out zone, or go and, be the one that goes and queues at the bar to take a break from the sound. Your ears will thank you. The next two questions are almost similar. Someone's asked about the best 3 things you can do, and then one of our anonymous attendees has said, which ones have the better evidence to say they're beneficial? I think the best 3 things for me would be finding an effective relaxation technique, whatever that is, whether that is a meditation, whether that is going for a walk in the countryside, whether that is breathing exercises, using sound therapy, which also can be relaxing. So having background sound so that you're not focusing on the sound. And the other one is probably the hardest, is try and keep doing the things that you do. Don't let tinnitus take control of your life. You take control of it. Try and focus on something else other than the tinnitus, whether that's your favorite hobby, whether that's a good book. Not giving tinnitus the attention it wants, a bit like ignoring a toddler tantrum, you just kind of let it go off to one side. They're easier said than done. And this is where sometimes you need the support, and you might need to go and learn some CBT techniques or mindful techniques to help you do it. In terms of the evidence bases, the best treatment, the one that's got the greatest amount of evidence, is CBT, but that doesn't really count as an autonomous technique initially. Once you've learnt the techniques from a trained provider, then you can apply them and you can use them. But in terms of the autonomous techniques, yoga and Qigong, we know, are good. Sound therapy can be good. And again, relaxation techniques, they have some effect, and mindfulness techniques as well. So I hope that helps. And I know that I think that,
or maybe like I'm just going to that thing is a very, very good summary. And then probably like if you want to talk to also, like in case you're unsure, I think it's really important to find someone you trust, a tinnitus expert, someone who knows, who is trained to basically provide tinnitus care. And there would definitely it will help you. There's support available, and there's, depending to your own story, your own characteristic and your own struggle, we will basically be able to sort of help you to identify what are the things that you can sort of like implement. But I think focusing on the things that you love and being able to re-engage in case there's any activities that you stop doing because of your tinnitus is going to be really something that is going to allow you to see that there is differently some situation while you are so engaged, it could be painting, playing music, dancing, that you are so concentrated and focused that you don't think about your tinnitus. And once you identify this element, you will see that it's possible, and it's just about step by step increasing the amount of time where tinnitus is not in the front of mind.
Question about the MindEar device. We do have an opinion that's on our website. I would say for some people it does seem to work, but there's still an awful lot more research needed and independent research needed. It is expensive as well, so that might factor into your decision. The team behind it are very dedicated, but like I say, we need a bit more research. I will say MindEar do support Tinnitus UK financially, but if you have a look on our website, you can see that our opinion is very much independent of that. I've mentioned trials. Somebody wants to know about offering oneself to local clinical trials. If you go to our website, Tinnitus UK website, we do have information there about how to find your local trial. We've got UK specific information, but we've also got worldwide information. Clinicaltrials.gov is a good place to start if you're not based in the UK. Prescription drugs cause tinnitus? That's a difficult one, because sometimes the disorder that you're taking the drugs for can be the trigger behind tinnitus rather than the drugs. There are some drugs we know do cause tinnitus, but they tend to be the really powerful drugs. They're not generally the type that you get from your local doctor. They are the big chemotherapy drugs. They are the intravenous antibiotics if you've got sepsis, and for life-threatening conditions, some of the drugs that treat those can cause tinnitus. Quite often, if you are experiencing tinnitus while you're taking some prescription drugs, when you've finished the course and when your illness is resolved, your tinnitus resolves too. I'd always say don't change your medication without talking to your doctor if you're thinking of stopping it. Have you got anything to add to that, Fabrice?
No, that thing was exactly what. Most importantly, if you have any question or if you're unsure, you should definitely talk to your medical doctor and being able to check it. That's again an important thing, and you should basically. Anybody who is unsure should basically talk about that. And then there's a question that I will going to answer about, is this presentation going to be available? Yes, so I'm going to send you an email after this presentation, giving you access to a recording of this presentation. The presentation are available also inside the MindEar app. If you go in the home page, you will see that you can access all our webinars and all our masterclass. And the masterclass, anybody who has a premium membership to MindEar is able to access the masterclass. So yes, and it's going to be available in the coming hours.
Right. Andrew has asked about earplugs. I would suggest you only wear earplugs in loud environments, because if you wear them in quieter environments, that might bring your focus back to your tinnitus, because you're excluding external sound. So I'd always say be cautious if you're wearing them, for example, to sleep, or if you're wearing them to doing jobs that have got a normal level of sound, like the washing up or vacuuming. Wear them if you're doing, getting the chainsaw out in the garden, not so much for just pottering around. Yeah.
Yeah, and I think put on that, I would have so hyperacusis can be there's like protecting ourselves is good, but overprotecting can have a negative impact. And it's where it's really important to not overprotect yourself. I'm going to potentially answer the next one, which is about sound therapy and finding and the question is like, when using sound therapy, should the sound be louder or lower than the tinnitus? So the sound therapy should always be lower than the tinnitus, and I will basically add that we are like at MindEar, we are basically inside the treatment that we're offering inside the group session. We have 2 sessions specifically about sound therapy. It's really important to understand how to apply sound therapy to get the maximum effect. And it's really important to not actually have the sound at the same level or even higher, which always need to be at a lower level than the tinnitus in order the 2 sound need to coexist in order to induce the habituation. And so if you want to get more information, either you can basically book an appointment, but I will also, if you want to be part of the program, there's like some education about sound therapy, which is really important. How to use it, when to use it, what sort of sound to use, and so on.
Okay. Next one's a technical one about the app, so I'll let Fabrice deal with that.
So that I will probably answer also about the app available. The app is currently not available in all countries in the world. It's currently available in New Zealand, Australia, UK, US, Canada. It's currently not available. I don't know your country here, but so yeah, it's mainly available in English-speaking countries, and we are working to translate it in different language, but it might take a little bit of time. So in the meantime, I would recommend you to subscribe to our YouTube channel, which is basically accessible, and it's where we are also providing access to all the webinars and masterclass. So if you go into YouTube and search for MindEar Tinnitus, then you will be able to subscribe there.
Okay.
Next question.
Audiologist, do you want to ask? There's a couple of questions about hearing aids. Do you want to answer those?
So hearing loss, unfortunately, they do not have. Yes, so I'm going to read the question. I have hearing loss and wear hearing aids. Unfortunately, they do not help. When I am with a group of people, my tinnitus become unbearable and I have to leave. I hate becoming a recluse. Do any hearing aid actually help? So that's a very good question. It's where we see like how we react is very individual. There's some meta review that were published relatively recently about how hearing aids can help with tinnitus. It was showing that around 70% of people who are wearing hearing aids found them helpful. And it means that 30% of people who are wearing hearing aids don't find them helpful. And it's where there's not, the truth is not for everybody. And it's where there's a different aspect for the hearing aid. The first thing could be the fitting. So you need to work very closely with your audiologist in order to identify if there is potentially some fittings that you could do in your hearing aid in order to attenuate. It could be certain frequency or potentially to activate some noise reduction inside the hearing aid that could help. So working very closely with your audiologist is extremely important, and that would be my recommendation. Again, it's about trying to identify what's happening, why there's a reaction. It could be an emotional reaction. It also can be some fear of, now that you experience one, that the hearing aid was a problem in a certain situation, and potentially because there's an increase of the volume, there's this fear of going back to an environment where it's uncomfortable. So there's a technical aspect about the hearing aid fitting, and there's an emotional aspect. And so potentially, if you want to talk a little bit more about that, also I would recommend to book an appointment, and we can talk a bit in more length about that. A question, I think, any information about low-level laser therapy for tinnitus?
Yeah, we have, because I did them last week, because there's been a couple of new ones launched on the market. We have updated our information about low-level laser therapy on our website, but the short answer is they don't work. There is no feasible, plausible mechanism for them to work. They have changed some of the blurb and quasi scientific information about them. They now no longer talk about chlorophyll in your inner ear, which is quite good because chlorophyll's in plant cells and not in human cells. Otherwise, we'd all look like the Incredible Hulk. So yeah, it's an idea, but it doesn't work. I would avoid, save your money.
Yeah. Thanks for, I think and it's where, and so good to have these questions, and other people also can benefit from the answer. Another question about hearing aid: what is the best brand? It's very hard to answer like this question specifically. It will take a bit longer to talk about that. We know that hearing aid have features, tinnitus features, and generally it's around sound therapy. They can give access to different noise or music in certain case. Some have what's called fractal tones, which are like non-repetitive stimuli, which have shown to be helpful. Not only to mask, but also to relax. So this is a relaxation component that Nic was talking about earlier, and which basically help the nervous system to release tension. And so it's really hard to tell you. I don't think that there's one brand that is really, I would not be able to recommend one brand, but it's really about the work that you do also with your audiologist. I know that it can be difficult to find time, but you need to have really a relationship with the person that you work with. Again, you can book an appointment. We can try to help you to identify someone who could help you with that, or we can directly try to guide you more, but it's very difficult to say. I don't think that there is one brand in particular. Is there a free version of the app? Yes, there is. So the MindEar app is available. There's first, we provide a 1-week free trial, and it's really there to help you identify if the app provide any value to you. So you can try the app for free, completely for free for 1 week, and test all the features that are accessible inside the app. And I think that's a really important aspect. Then you will get access to some, for example, some soundscapes. You will get access to a few meditation, few relaxation exercise. Out of the 18 relaxation, for example, the free version will give access to 3 relaxation exercise. So you can definitely get access to a free version of the app. Know that we are a small team. We are working hard in order to make the app as best as possible, and each subscription helps us to continue developing the app and creating the best app possible for you. So we are definitely very grateful when there's people who are contributing to the MindEar app, and meaning that it's your app at the end, and you are being part of this community. You allow the app to grow and to continue getting better. So for the price, in the UK, the app is £69 for 1 year subscription, and in the US, I think it's $75 for 1 year subscription. So we try to make it as affordable as possible, and it's really supporting our work at MindEar. So thanks for that. Is it possible to sign up for the trial in the UK? Unfortunately, no. It's there's like the clinical trials that we're conducting at UCLH. There's a clear process where you need to come from. You need to have a referral from an ENT, and so unfortunately, I will not be able to enroll you in this clinical study. Even though in the future we might be, if you go and download the app today, we are currently doing another clinical study or another trial with a master student at UCL, and so you can be part of different studies that we are conducting. The important part and what we really want to do with MindEar is really also to develop a program which can adapt to your needs. And then it's where we are also doing a lot of research, not having a static program, it's something which is really adapting to what you're experiencing. And so it's where we want to go in the future.
I mean, if you are interested in other
Yeah.
studies, then for the UK, have a look on the Tinnitus UK website. We're actually putting out another 2 shouts for volunteers for a couple of studies that will be going on this week. And some of these are doing online questionnaires. So although you have to be UK based, you can do them from the comfort of your own home. And people are incredibly grateful, particularly the masters and PhD students, because they don't have the resources of the bigger labs. There are no big labs, but they will find it useful. Can I just go back to
Yeah.
Penny's question about relaxation techniques?
Yeah.
Relaxation techniques are as individual as you and as individual as your tinnitus. So some people find breathing exercises are quite helpful. Some people find a guided meditation helpful. Some might prefer a silence meditation or a progressive muscle relaxation where you tense and relax your muscles. Some people like yoga. So there's lots of different things. I've done a leaflet about relaxation techniques that don't involve sound, for example. And one of the suggestions for that is actually blowing bubbles, because that gives you breath control. And actually blowing bubbles is fun. We forget to have fun as adults. And as particularly if we've got a chronic illness, you know, things can sometimes be a bit tough, but
It's a
who can
great
not
way.
smile and blow bubbles?
Yeah,
So
exactly.
it's finding the things that work for you, because some people, and this comes down to apps as well, and I'm sure Fabrice will back me up. There are some relaxation apps out there, and I've tried them, and the person's voice just grates, or the tinkly music in the background just grates, and yet the techniques would work, but the actual delivery doesn't. So sometimes you do have to play around and find what works for you. You know, in terms of sound therapy, there are people I know who listen to jazz or white noise at a low level. That would drive me demented. So it's finding what works for you, that you can stick to, that you enjoy and you find relaxing, which I guess is a bit of a non-answer, but it is as individual as you are.
Yeah, and it's about being creative. I can imagine. I love the bubble. It's so good to relax the jaw also. So you think a question about bone conducting headphone. Are they good to use? And my answer is yes, they are good to use in the sense that they are not obstructing the ear canal, and a little bit like the earbuds, the open earbuds that we're offering. That's a main component. They are allowing normal sound in your environment to be heard, and that's really an important element. So the only disadvantage of like the bone conductor headphones is basically the fact that they have pressure. They have a pressure point in order to transmit the sound through the bones to your ears, and then they can be, after many hours of wearing them, it can become uncomfortable. Ideally, in order for sound therapy to be working, it's best to forget about the device. It's best to forget about the sound which you are using, and it's just being part of your life, like the tinnitus is also becoming part of your life. And it's where having a hearing aids can be a very good option, in the sense that they are designed in order to be comfortable to wear during the whole day, and they have the battery life which can be also is adequate to be wear the whole day. But in certain case, in bone conduction can be also used. It doesn't have potentially all the advantage, but it still can be a very good way to sort of like get access to sound therapy.
Yeah,
One question. Yeah,
they're an interesting sensation if you're not used to them. It's very strange, isn't it? But yeah,
it is.
Some people find them helpful because they can then use the sound therapy and continue with their daily sort of life, particularly if they're working or they're looking after their children or whatever. So, yeah.
Yeah. Flare Audio loop earplugs, a gimmick or evidence to work? That's. Do you want me to answer this?
Yeah, you can answer that one, and I'll chip in if there's anything else.
So there's a lot of it's been a lot of I think they have been very visible, and they have been using a quite aggressive marketing strategy on social media, especially Flare. So the loop earplug are basically some earplugs which have an attenuation, which is and they are like I would say that they have the same efficacy that other earplugs. Potentially, some of their filter will make that the attenuation is flat. And what we mean flat is basically is all frequency of the ear spectrum are going to be attenuated in a similar way. So that's one of the advantage, and they are great to use, for example, when you go to your concert, your favorite concert or your favorite festival. The other, which is audio flare, is slightly different in the sense that it's not an obstruction of the ear canal, but it's a partial obstruction, and meaning that there's only certain frequency which are going to be attenuated. Currently, I did not see myself any research, so they have been promoted for hyperacusis, hypersensitivity to sounds. At this stage, I did not see any evidence for or any research published about the efficacy of this device to provide the benefits, for example, in the case of hyperacusis. So, and
I mean, I
Nic,
think,
I'll let you.
yeah, I think they have found it's been an accidental benefit, they say, and it's only anecdotal evidence that people have said that they're helpful for tinnitus. Flare did say they were going to do some research into that. I don't think that's actually been published if it's happened. With the flat attenuation for the loop ones, that's very similar to the musicians ones that you can obtain, which don't look necessarily as good, but they're an awful lot cheaper. It's really, if you're going to, again, I think it comes down to if you like the look of them, they work, and you're going to use them, they'll be fine. But they're not miracle workers for tinnitus, but they'll work for hearing protection. I think that's fair to say, isn't it, Fabrice?
Yeah. And I don't have the attenuation curve in mind right now. I know that I saw it at some point. I looked at it a few years ago, but right away I know that is potentially I can have a look and then send more information about that. Yeah. Some information about supplement, and maybe there's a good way to come back on supplement, because someone will tell us that would like to understand which supplements are recommended today.
The short answer is none of them. And it's not just me saying that, it's the writers of guidelines. They say that dietary supplements should not be used for tinnitus. And the fact that they are quite so definite about that is unusual, because academics are normally a lot more nuanced and balanced and maybe and this and that, but they're all very clear that they shouldn't be used. The caveat is if you do have a medically diagnosed deficiency, you may benefit if that's corrected, but that's very rare for most people in English-speaking countries, because our diets are so much better than they used to be. If you do think you might be deficient, speak to your doctor. But yeah, avoid. It's just easier. Just avoid supplements. It's probably my answer to that one. Save yourself some money. Go and buy
that's
a
very
nice
good.
bottle of wine or a decent coffee.
Yeah, and so it's a very good to go back to this one, I think, because it need to be quite clear. And then there's currently no evidence for to help with your tinnitus. You will see a lot of ads online, and it's where probably one of the message that we want to give you here is like, don't spend your money there. That's going to be, as Nic said, go and buy an ice cream, a good ice cream, or something that is going to make you happy, and is going to be money much better spent. So and it's probably one of the important message. And when we, as scientists, as we have been working in this field, and we know that, but it's so important for us to tell you what is able to provide you a treatment option which is efficient, and the one we are not working. So good to spend a little bit of time on this one.
Mindy's asked about the name of the earplugs I like. The ones that I use are ACS, but to be honest, there's quite a lot out there. If you look for musicians' earplugs, and if you look for the words flat attenuation, and if you look for 18 decibel attenuation, because that's a good level of sound level reduction, you shouldn't go too far wrong.
Yeah, and again, if you need to wear earplugs long hours, there's a possibility for you to see an audiologist and to get an ear impression, and to basically get some earplugs which are specifically made for your ears. In this ear impression, we're going to be able to put a filter with different attenuation. Nic was talking about 18 dB, which is actually quite a very standard, and you're going to be able to change it to a 10, 18 or 25, and 10, 25 is generally going to be the highest level of attenuation that you can have. But then there's this option for most of us, when we go to a concert or for 2 hours, non-customized earplugs are completely fine, and they will be working very well for you. So it's really in case certain profession, you will need to wear earplugs for 6 hours, 8 hours in a row, and in this case, it can be worse to invest for something which is custom to your ear.
Yeah. Carla's asked about sleep and what she's taking for sleep. I'm not really medically qualified. I think really you have a word with your primary physician, because it may be that you need to go and speak to a sleep expert to get that sorted out, because that does sound exhausting, and actually improving your sleep would probably help with your tinnitus.
Yeah, it's very common. So I must say that the number one request for people, for MindEar user, is to sleep better. So you are, it's not something, you are not isolated, and we know that sleep is important for recovery and getting the energy you need to sort of like get your nervous system in a place where you can habituate. So yeah, I think seeing a sleep expert is really recommended.
And this one's almost sleep related as well, from Claire. She notices her tinnitus loud in the morning, and the brain's up as you drift off to sleep. I think they're possibly not related. They're both very common experiences, actually. Noticing your tinnitus louder, and actually this kind of extinction burst as you're drifting off to sleep. Quite often it's because it's very quiet in the morning when you wake up. And so your tinnitus hasn't, your brain hasn't got anything else to focus on, and hasn't started thinking about the day. And so it's grabbing onto your tinnitus first thing. So actually sometimes you can get radio alarms or sound generators that you can program to come on before you go to sleep, and so that they come on as you wake up, and that gives your brain something else to focus on and to listen to first thing rather than your tinnitus. So that might be helpful.
Yeah, that sounds a speaker which are dedicated for sound therapy, and as you mentioned, good. Yeah. Can COVID cause tinnitus?
The evidence seems to suggest that it can, but some of that evidence has changed fairly
Yeah.
recently. We do know that tinnitus is a symptom of long COVID. I think that has been established, and why that is. But the initial evidence that it did, people seem to be thinking about that and wondering if the evidence is not as clear cut as it was. I think I'm right in saying, onto Fabrice.
It's relatively it's mixed. With this mixed result in the current research. Like when we control, we have the belief if we control for the rate of occurrence of tinnitus, meaning that what will be the if you are 55 plus, the prevalence of tinnitus is over 35%. And meaning that depending to your so if we take that into consideration, it's not been extremely clear if tinnitus was could be linked to COVID, even though we can see that it's linked to some of our sense, our smelling and was definitely and testing sense were affected. So there's some inflammation that might be happening also in the ear organ. At this stage, it's not exactly clear. So we need potentially a bit more time, and hopefully with time going to get more paper coming out. It's also research is slow, and it's one of the things. Takes time for scientists to do the research, publish write about the data, the research, and publish it. So it is always a delay before what happens and us knowing the impact. We got some thank you. So thank you for everybody who has attended this webinar. It's great to see so many questions, and we try our best to answer them all. But thanks for everybody who came to this session. It's very lovely always to see so many people, and we love also to help you to find your way to this place where you don't found tinnitus bothersome anymore. So yeah, thank you for your message.
Yeah. I think there's a couple of questions about MindEar there for you, Fabrice.
Yeah. So one about hyperacusis. Yeah, so we have definitely webinars and masterclass. So there's 2 masterclass available inside the MindEar app that I would recommend with Professor Log Jacquemin, which is an hyperacusis expert, and I will definitely encourage you to watch them. So if you have the access to the premium version, in the home page, there's a section with all our videos. If you click on watch all, you're going to see that you're going to be able to filter the masterclass, the webinar, and if you go into masterclass, you will see it. We are trying to we had one masterclass on Monday about hyperacusis for our friend from down under in Australia, but we're going to run another one in the following 3 months. So I will keep you updated. Will MindEar provide sound therapy available offline? Or yes, so that's a good question. If you download the sound a first time, the sound will be in the memory of your phone. So it's only the first time. Once you have been able to download the soundscape when you are online, then you should be able to use the sound therapy offline. Can tiredness exacerbate tinnitus?
I think a lot of people say yes, including myself. I know when I'm experiencing tinnitus, it's usually because I'm tired or stressed or both. So yes, it can, and guess,
Yeah.
you know, we know that people who aren't sleeping well feel that their tinnitus is more intrusive.
And it's quite interesting, Nick, because it's something as being in contact with people who have tinnitus. We definitely see this link, but I don't know any research who has been looking at that. I don't know any paper in top of my mind about looking at the impact of we know there's a lot of stress, as I know papers about stress and tinnitus, but taking care of ourselves, and sometimes we need to reminder, we need to be grateful, and but also grateful for our body, but we also need to take care of ourselves. And so
Yeah,
in the sense, in many being able to take a breath and being able to remind that if we don't take care of ourselves, we will not be able to take care of the people who are around us is
yeah.
important. So you need to allow yourself to get a break.
Yeah, I think one of the things perhaps I should have said when somebody asked what are the top 3 things you should do is actually the first one should be kind to yourself and your body. So make sure you're getting your rest, make sure you're having a decent diet. I know we've said diet isn't a factor, but if you've actually got a healthy diet and your well-being is generally good, then you stand a chance of managing better, you're more resilient, you've got less stresses on your body. Would be how I would put it. And yeah, be kind to yourself and take the things that you need.
Yeah, no. We have a question about MindEar. Do this option to help with that as well are correct for MindEar? And we can, as I can imagine, so tinnitus and mania is a very specific medical condition. It's a very challenging one, and it's where diet is. We know that again, it's slightly more complex there than only tinnitus. We know that there's variation of the hearing, meaning that there can also be variation in the tinnitus sensation. And then we know that it's the fluid which is inside the cochlea and where the concentration in ions is changing. And it's what's generally creating this vertigo and also a change in the hearing function. And meaning that there's a lot of potassium inside the liquid which is inside your inner ear. And there is in certain cases where a change in diet has been able to impact, for some people, again, it's not everybody, but some diet has been able to have an impact on MindEar. But again, I would recommend you to talk with your doctor about that because it can be quite personal. So about the other option, sound therapy can still be beneficial if you have MindEar, but you need to be able to adapt it to the tinnitus level, and meaning that it can be variation. In the same way that amplification might need to change because your hearing threshold might vary from one day to another. That's the challenge about MindEar, and relaxation is still can still be applied. Cognitive behavioral therapy, many years ago, also is not going to be here forever. And it's like, it can be so distressing when we are in an episode that we can definitely have dark thoughts coming, and then being able to reassure ourselves, either if you have been able to sort of like work with someone to learn about cognitive behavioral therapy, but also being able to get some support from people around you in this difficult moment is really important, and knowing that it's not going to stay like that all the time and it's going to get better is really important. So MindEar it's a very, very, very challenging condition, and it has its own challenges. I don't know if you maybe anything, Nic, that you would like to add on that.
No, I think it because it is 3 quite distinct symptoms and they can all have their own challenges. actually using what you need at the time, for example, the relaxation or using the sound. But it's probably one of the things where professional guidance, it may be more needed because of the combination of things. But yeah, things like sound and relaxation, they're not going to be harmful in any way. So they can be applied.
Thanks. Do you work with Dr. Bruce Herbert, who does CBT for tinnitus? So one of the core elements of the treatment options, that the treatment that we are providing inside the MindEar app, is CBT-based exercise, meaning that we try to help you to give you the education in order to understand what is the relationship between how we think, how we feel, and how we can basically modify that. We are not directly working with Dr. Robert, but the treatment option is based on similar principle, which are the principle of cognitive behavior therapy, which we know are able to be very effective if they are like both provided but also implemented in your life in a right way. So I would recommend again to talk to a CBT specialist or one of us at MindEar in order to get some recommendation about how to implement this technique. We have. Yeah, maybe for do you is tinnitus linked to perimenopause, and how likely is it to disappear after menopause?
I think this is another question, isn't it, Fabrice, where there needs to be more research, but there is some evidence that because of tinnitus is often regarded as being something linked to a change in either your physical or your mental well-being. And as we know, perimenopause and menopause can affect both. So that could be why it's triggered. Also, tinnitus is more common in people as we get older. Fabrice mentioned 35% prevalence when you hit 55. 55 is towards the end of people's perimenopause range. So I think there is some kind of link there.
Yeah, and
but it's under researched, but such a lot of stuff about menopause is under researched, and it's only just really now being talked about. So I think
exactly.
Watch this space.
Yeah, and for the things that we can maybe add is like in the case of menopause, like the treatment option will not change hugely. So we will basically talk about the same kind of meaning that a combination of this and like potentially one of the things to talk about is being able to combine different elements. Generally, it's not going to be one treatment option in the isolation, which is going to help you fully, but it's by combining and by getting an improvement of 20% there, plus 20 plus, and it's going to be when you basically sum up the benefits that you get from each treatment option that you're going to really see a benefit. Yeah. It's challenging to find what works for you, and it's probably one of the things with is the most tricky with tinnitus is what worked for your neighbor is not all. It's potentially not what is going to work for you. So you need to be careful about what, and it's where like evidence research is looking at a group level where we try to look at an effect for a group of people. And now a new research avenue is to be able to really specify subgroup and meaning to identify what are the treatment options, how certain treatment option can affect this different subgroup.
So I
and potentially
I put a question in the role. I marked it as answered and it hasn't yet been. Our person says that they're using sound to assist with sleep and they're listening to it through their Bluetooth hearing aids, but the hearing aids themselves are not comfortable in their ears. And do we have any recommendations for a better mode of listening so that they don't disturb their wife?
Yeah, maybe I can. So there's the different. In our case, we are proposing like a sleep band, which has the benefits of being relatively comfortable. The speaker are behind the ear, and they are generally not on the way. So a sleep band can be a very good option, and we can help you to access one. We know that there's a specific type of hearing aid which don't need to be removed. There's one type which actually has this advantage of it's called the Lyric device, which has this advantage of being introduced, and you need to change the battery every 3 months, if I remember it well. And it means that you don't need to change. But in this case, the Lyric doesn't have sound therapy, which is also another. It can amplify. Give you access to environmental noise, but it means that you can't get access to the center. So probably the sleep band will be, in your case, a good option. And another thing that now summer is around the corner, try a fan. Try to get a fan close to you. Sometimes it can be a very effective solution. It has this sound which can be relaxing, and generally, if it's warm, dependingly where you are in the world, if it's warm enough, it can be pleasant, and it's generally not impacting the sleep of your kind. So yeah, it could be another option, but you can potentially write an email to me. I'm going to write in the chat. So if anybody who is still here has any question, and just, oh, sorry, I did a mistake in my, you can send an email at fabrice@minddear.com if you have any question, and I will be happy.
I have to say, I was once at an event and somebody came up to speak to me and said, "Thank you for saving my marriage." And I was like, hang on, I'm tinnitus. You know, have you got the right person? And it was because we'd spoken to her husband who had tinnitus. We'd spoken on the helpline, and we had suggested the sleep bands because she couldn't stand having noise in the room as she tried to sleep, but her husband needed to sleep. So he got the headband, the sleep band. She got silence, and everybody was happy, and that was lovely. And I think even if you've got, I think they work. They're not going to work if you've got a huge hearing loss, but they will work for most people because the speakers are right over your ears. You do look a bit of a Wally, though. They're not the most attractive.
It's at night. Nobody sees.
Nobody sees. Yeah.
It can be a bit scary. I do wear them from time to time, and then when you go to the toilet, you look. It's true. It can be a bit scary. You can scare yourself. But as I did write my email inside the chat, don't hesitate to write me an email. I will give you access to give you some information. And the last question before we finish with this very interactive session. My tinnitus is significantly increased around tea time, early evening. Could there be any reason for this?
I guess it depends on your routine, doesn't it? If you're by tea time, I'm certainly flagging. You may be more tired. There may be a change of environment. So perhaps if you've been working in an office and then you come home and there's nobody there but the cat, there's quiet. Or it may be that you find that you come home from work and you know that you've got lots of things to do and you've got dinner to cook and laundry to do. You're getting stressed and tense. There could be lots of different reasons for it. Maybe kind of have a think and identify something, and then you can, using some of the techniques that, CBT techniques or relaxation techniques, if it's a stress thing, if it's because you are shifting from loud to quiet, maybe using sound techniques. So there might be, now you've identified a pattern, it's easier to deal with, I think would be my suggestion.
Exactly. And I think, I mean, knowing that variation appears, and it's normal to feel that it can be some variation, and acknowledging it. And so it can be stress, it can be feeling tired. It's definitely, we can see a relation. Sometimes it's more difficult to identify. Some people relate that tea or coffee can also provide, can be basically have an impact. Not everybody, and that's but being able to sort of also acknowledge it, see it, but not reacting. So it's really an important thing. Trying to control your reactions. That even if there's one thing which is a sound increasing, and it's a reaction to the sound, which is another component. And even if we can't change the sound increasing, we can basically decide to control our reaction to the sound. And that's probably, if you see that it's going to come, it's potentially time to engage in a relaxation exercise, or engaging in something, maybe going out and taking care of the flower, and then basically, or talking, giving a call to someone in your family. So I think it's really important to identify if there's the sound itself, and ourselves as a person. We have the possibility to get angry, or potentially to refocus in something which is really something which is important for us. And at the end, you're going to see that if you focus back your energy into what matters, the sound is going to disappear, independently to the loudness. So yeah. Thanks so much, Nic, for being here and for bringing this knowledge. It's I think very important, and I hope that well, I think I was very happy about the audience. So many people were able to attend this webinar. I think this information should be accessible more widely even. And so I hope that we participate to make this information, and I hope that it's only the beginning.
I mean, I think that's the key. We have this information, but it's got to reach people. And it's been fantastic being able to have so many people on the call and to be able to answer so many questions. And if people still have questions, our support team will be back at the office tomorrow. If there's anything you've forgotten, or you can email me directly and I can direct you to where you need to go. And Fabrice has put his email up there as well, which is great. Yeah, because I think there is so much, it's such a maze of information, and some of it is good and some of it is bad. It's actually picking your way through it.
Yeah. And thanks for Tinnitus UK for the amazing work that is completed. It's one of the organization which is more active worldwide. And thanks for all the work that you are doing, Nic, supporting but also advocating for tinnitus sufferer and making things change. It's one step at a time. We need to be patient. We need to be resilient also in this work, to be able to make that the people who decide understand that we need more resources to have more research and more treatment option available.
Yeah.
There's already things happening, which is good, but we need more. So thanks a lot for your work, and thank you for everybody who stays that long. It's been a pleasure to have you all. I hope that you learn a lot, and that you are going to be feeling also hopefully some release and some positive impact of being able to attend some of this session. Knowledge is power, and then so I hope that you were able to benefit from this webinar. Anybody who want to get access to one of this offering, please contact us. There's different way, but the email is probably one of the best way. Get an appointment with one of us, and it's also very important to get this recommendation, so based on your history. And then we're going to have, I will send the recording in the following days so that you can watch it again if needed or if wanted. And then we are going to organize many more webinar and masterclass. So looking forward to see you soon on another webinar or another masterclass. Thank you very much, Nic, again.
Thank
Round of
you.
applause for you. And then looking forward to continue working with you also at
I'm,
Tinnitus UK.
I'm sure we will work together in the future.
Thank you very much. Bye bye,
Thank you.
Nic.
Bye now.
Bye bye, everyone.